Okay, we started. This is Dr. Sean over at Fortis Colleges. We're doing this. Here you see me down in this little tiny corner down here, way down over here. And we have the dashboard up here, and I'm going to be going over. You can see my cursor, I hope, and we can see the. We're just going to go over this class here, which is terminology. So let's go into here and see what we can find real quick. And we're going to go to modules for you guys. This is the wrong one, so I'm going to go to modules here. Ding, ding. Good. And then we're going to scroll on up. And we're going to look at our second week. Let's look at week 2. I'm just going to go over kind of everything in through here. We're going to look at all the reading and kind of the other stuff here, if I can get this thing to work. Kind of getting used to this now. So we musculoskeletal system and integumentary system. So integumentary, think of it, it maintains your integrity. It keeps the stuff on the inside, and the stuff on the outside. And of course, musculo, which is muscles, and skeletal, which is, skeletal. That's all those kind of things. So you're going to learn the names of the bones, and I'm going to go through them really, really quick. And I'm going to go through a bunch of muscles, and then we'll go through the integumentary system as well in some kind of form. So let me see if I can get over to, because I'm so used to I'm not used to using this very much because I have 2 monitors going on. I have a camera, I have a bunch of lights and stuff like that, and I'm trying to get things going. So task reading is ongoing, discussion post is ongoing. So remember, most of the stuff, the initial discussion post is due, what's it called, Wednesday. And then after that, you can do your response to those. Remember, you have to have 2 responses to each one of those. So don't forget that kind of stuff. We'll go through this whole kind of thing here. Wait, that's a really good thing to have. Let's go previous. Now I'm just going through, and we're going to go through chapter 6 real quick. Now, I've done other videos on this one already, but this is only for vocabulary. Now, I have another video on here. You can look that one up on the rest of the channel. Don't forget to subscribe, guys, because this is for the Fortis online class. This is 105 OAHP, 105.02 and 06, and etc. So for all of the those classes. So this is not in lieu of the Zoom meeting, which we'll have later on in the week, and that's to hammer out some of the other issues that we may find. So I'm going to be looking up and down and trying to contact with you guys and get this all going. So the anatomy of the integumentary system. So look at this. You guys were already looking at anatomy and physiology in this kind of thing. More the anatomy, because remember, anatomy is just a word for where things are and what they do. Describe the function of the system, spell the integumentary system medical terms, and use correct abbreviations. Abbreviations are very important. Unfortunately, some of the abbreviations can be misread and misled, so be careful with those. So something like we would use in respiratory therapy, which is SOB. Well, some people would see that as an insult, but it means shortness of breath, right? So if you know what that is, you can give me a thumbs up or something. I don't know. Integumentary human body, skin. So the integumentary system, it has a little video in here too for you guys. Look at this right up here, and we've got also, let's see, breaking parts, spontaneous, anatomy, structures. There are 3 parts. Here we go. Epidermis. Epi means on top of. So the epitome is the top. The top cut is what it really means. Dermis is the mid area. A lot of stuff, most of the things that do stuff is in the dermis. And then hypo, which means below, is the hypodermis. So we see that right in through here. We can see these little areas. You can see the hair follicles. Let's see if there's any other words in here for pronunciation that we may need to know. Hair shaft, easy one, right? Poor. Erector pili muscle, that's right in through this area. Erector. It's not erector, it's erector. Gets commonly mispronounced. Sebaceous glands right here. These make an oil. You can look up the other stuff too in there. Hypodermis. Hypodermis as in hypodermic needle. Cutaneous system is the whole skin, right? Cutaneous is a tissue, is an epithelial tissue. Remember, there's the 4 types of tissues if you get into that kind of thing with the, what's it called? The anatomy and physiology. This is more vocabulary, guys, right? So thick skin, this is dermis, hypodermis, keratin. Keratin is the kind of waterproofing protein. It's a protein that your body makes. Eventually, it's the outer layer of skin. So when you get ashy or something, or when you get like, your dry skin and stuff, that's dead skin. That comes off you and floats around the room and ends up all over stuff. So when you put your finger on top of the refrigerator, you're like, oh my God, what is that stuff? That's dust. What is dust? Dust is a lot of lint, it's a lot of debris from stuff, and it's human skin cells. They say that you're releasing like 400,000 or 40,000 skin cells a second, something like that. And they're flying off, and there's also these little mites that eat them, by the way, which is really kind of fun and groovy and really gross, because that means they poop and they have sex on you. And they float around and they settle inside your house. So over a lifetime, you could fill up a house with all the dead skin that has come off you. So that's a lot of dusting that we've been doing. I used to have a totally different set of slides for this. I don't have them anymore. Adipocytes means site, C-Y-T-E. Whenever you see that word, site means cell, okay? Adipose means like adipose tissue, which is fat. And then phagocytes. Phago means to eat. And Pinot, like as in Pinot Noir, you drink. Pinot. So pinocyte is a drinking cell, or pinocytosis is a condition of the cell drinking, and phagocytosis is the eating, okay? Now there's other weird words that are there too. There's phagio, which means to speak. So you can aphasic, like someone who can't speak. It's not aphagic, which is someone who can't eat. That would be actually anorexia. They don't have a appetite. See, a lot of words, man. And the more you know them, the better you'll get, and the more you practice them. So these ones here, oh, you have to add where they're at. So you can scroll back to the other picture, use that as a reference. Hint, hint, what I would do is open up a second window, use them, and then use that as your guide. You can go from there. Okay, if you guys are on computers, hopefully you're on computers, you can open up extra windows. Physiology, protection, sensory function. It doesn't have sensory function. It holds the sensory receptors. So you have like these Meissner's corpuscles and Pacinian corpuscles. I talked about those a long time ago because what we were talking about actually was getting different words. So there's different words, right? So there's Latin words, there's Greek words, there's some other scientific words, but this one here is a name, Meissner, Dr. Meissner, and Dr. Pacinian, or Pacia, I think. Sympathetic nervous system, blah, blah, blah. You can go through that. Body temperature drop, talks about the blood. So we'll probably talk in anatomy class when we take that. We actually go through homeostasis, and it talks about keeping warm. So this class kind of dovetails with that one, which is kind of interesting. Vitamin D synthesis. So your body makes vitamin D because it's been exposed to ultraviolet light. And the reason that you have the skin color that you have is because your people, your ancestors, come from an area, or you come from an area, that has had a lot of bombardment of, what's it called, UV rays. So let me show you an example. Okay, so hang on a second. I have this cool and groovy little moon. This is a little moon model. So we see the light is over here, right? So there's the sun shining on the world. And if you're in this area, this is the equator. There's a lot of light approaching here. Now let's imagine that this thickness right here is that far is the atmosphere. Okay, so right through there, it has to go through that much space to get to you. That's not very much. But if we go through here and we're taking lines of light directly, it has to go through an angle of it, and these guys way up here get way less. So what happens is these guys way up here have need less protection from the ultraviolet rays, so they have lighter skin. Melanin is what gives you your skin color. So there's a few things that give you your skin color, right? Your family, your genetics, your activity, are you outside all the time, right? And then environmental issues as well. So as we go through, and we can look at those. Hair, kind of same thing. Different kinds of proteins in there that make them either curly or straight or whatever. And then there's different colors of melanin and eumelanin and pheomelanin. Those will do that. Don't worry about it right now. Okay. Eccrine sweat glands. Let's go through here. I want to see. You get wrinkles when you get old. Oh, and then they have cancer cells. So they go through the ABCs of melanoma. So ABC is right here. Asymmetry. Is it symmetrical? Is it an even border, or is it not an even border? If it's uneven, that's not a good sign. Is it have or if it's like not a normal shape, if it's funky shaped or something, that's not. You should be able to split it in half and have equal halves, basically. B is for border. Is the border smooth, or is it irregular? Irregular is not good color. brown, black are okay, but then it'll have different shades. That's not good. Diameter larger than 6 millimeters, about that far. And then evolving shape has changed. Does it change? You don't want them to change. Albinism. So albinos, they don't have melanin production in their body, so they don't have the melanocytes making as much melanin. They tend to be very, very pale. They have like even whites of their eyes are almost pink, and sunlight would really bother them. They tend to have other issues as well. In some parts of the world, they were seen as almost magical people, and sometimes you would even want to get a hold of an albino kid and kill them and grind up their bones and make stuff out of them. I don't know why. It wasn't very lucky for the kid, was it? So it shouldn't be lucky for us. Yeah. Other skin things, jaundice. Jaundice is the yellowing of the skin. It'll look exactly like highlighter yellow. So this is highlighter yellow right here. This is you can't even see that color. That's terrible. But imagine if I colored the inside of my eyes, the white part of my eyes with a highlighter. That's what it looks like. It's a very weird thing. Other skin disorders, tinea. Tinea has to do with the skin. So any of these tineas. Know this one here. I don't know what page this is. It doesn't say. This slide here, or this section of the book, be very important because they'll definitely have some kind of quiz information there, right? It's an easy one to do. They always have those kind of things. Burns. Oh, burns. We go with the rules. Okay, so we have here, this one here, the rule of nines. The rule of nines is body coverage. So if you have 9% of body coverage burn, first, second, or third degree, or whatever it is, these used to determine really survivability. Anything over like 40-50%, you were not going to make it. But these days we're so good with the way we care for people in emergency care that people live with a lot more stuff, and we do more skin grafts and all kinds of really weird things. Okay, there's a fourth degree is underlying muscle and bone is charred. That's not good. You probably won't heal from that one, or it'll probably have to be cut off or something. Different kinds of scars. Different kinds of scars would be keloid scars, for example, are more bumpy. So, oh my gosh, look at all these. Something that generates... What is that? Okay, we'll go over that later. We're going to do that. So let me go through real quick, and these words, as we're going through, here's like a really good... So here you go, integument vocabulary. Adipocytes, fat cells. Adipose tissue, autonomic nervous fibers. Avascular. A means without. Vascular means vessels. So arteries and veins are also vascular, right? That's vascularization. Benign is not bad. Non-harmless, usually say. He was a benign character, right? Cancer. Cancer is overgrowth of abnormal cells. It has two choices, benign or malignant. Malignant is bad. Mal, M-A-L, means bad. Cyanosis. Cyan is a color. Blue. Cyanosis is blue skin when someone doesn't have oxygen. Debridement is to take away the skin. So if you have an injury, they debride. Scar tissue, sometimes they'll do burns, road rash, things like that. Dermatologic, dermatopathology. Gee, many crickets. See how you get stuck? Here's the thing with vocabulary, guys. There's a cadence to each of the words, and when you learn that, it's much easier. It's hard sometimes you don't see them. So the word like spatula, if you're just looking at it the first time, you haven't seen it, it's like spatula. You don't know. So different words have different cadence, which means the way that they're pronounced. Autonomic, or like hypophysis, or something like hypophasis. You can say these different things. Dermis, that's a layer of the skin. Epidermis, the top of the skin. Excise, cutting away. Like anything X is to get out or get away. Okay, so excitosis, active transport out of the cell. There we go. Exit. Think of exit when you see those. Fascias, fibrous tissue, frostbite, not good. The skin actually freezes, hypodermis, infection, intravenous, jaundice. We did that one. Keloid. Keloid is a type of scar. Keratinocytes, Meissner's corpuscle, melanocytes. Melanocytes we talked about they make melanin, and they're a cell inside your skin that makes melanin that gives you the color of your skin, the darkness, and it's determined by the amount of light that's shined on the skin. Necrosis is death. Necrotic, dead tissue, right? Osteo, anything osteo is bone, anything myo is muscle, but also anything sarco could be muscle. There's a little trick in there. So we have myo, which is Latin, and sarco, which is Greek. Two of those. So I guess they had two different offices and they didn't communicate with each other, right? Rickets, or rickets, some people would call it, a painful condition in children where bones are misshapen due to lack of calcium and vitamin D. Very common. Vitamin D is actually what rickets is from. Okay, scars, stratum basale, sympathetic nerve fibers, and vascularized. So there you go. You can go through the entire list. There's the entire chapter. So this is, wow, gee whiz. We just did 15 minutes. I'm going to leave this one at that. We're going to do another chapter later on. I want you guys to check out the announcements. Always check the announcements because I do put these on the announcements most of the time. I'll put like a notice that I've done this. This is going to be on the YouTube channel, of course, so don't forget to like, subscribe, and all that kind of stuff if you want to receive more. You don't have to. You can always unsubscribe later. But get the subscriptions going for that because it can help you do other stuff. I do requests and things like that. So anyway, go through, remember when you're doing discussion boards and you have to answer two people completely, and don't just say, hey, I really like that post, or that was really, I agree with you totally. That doesn't make the conversation go on at all. So we need to do that one to get the full credit, okay? You guys are really doing great in this class. I mean, I know this is August 2021. You guys are kicking butt and taking names already, and I'm really proud of you, and that kind of does motivate me too. So keep contact with me. I know you guys are really good with some of your emails and turning in stuff. You guys are doing really good, and we'll keep going from there. I'm going to stop recording, and we're going to see you on the flip side. Bye.